Performance health assessment really starts even before you set foot in the office. We're going to send a comprehensive intake form looking at your medical history, your geographic history, your lifestyle, your nutrition, what your day-to-day activity is like, what your stress levels are like. We want to know everything about you before you even walk in the door.
Our performance health assessment starts with a phlebotomist will show up at your house or place of work and draw biomarkers. We're looking at advanced metrics on cholesterol profile, hormone profile, inflammatory markers. After that, the patient comes to our office and they're greeted by their performance health coach, their service coordinator, and their Cenegenics physician. The day starts with a FDA-cleared device for brain EEG. We're looking at the voltage and the brain's physical reaction time to a stimuli. After the brain EEG, we progress into the diagnostics portion where we will get a DEXA. A DEXA scan is the most accurate way to assess body composition and bone density. Ensuring that we have enough lean tissue as we age is vital for longevity. Bone density often gets overlooked. The DEXA machine will measure bone density and body composition. After the DEXA, then we roll into our carotid intima media thickness. This is a cross-sectional view of your carotid arteries. Carotid arteries are very easy to look at because they're superficial or close to the surface. The carotid arteries also correlate generally to what's going on in your coronary arteries. We will scan for any plaque because there should not be any plaque. Plaque is evidence of a disease. With the carotid intima media thickness, we actually measure the intima and the media. Those are the inner and the middlemost linings of the blood vessel, and we're looking at them in millimeters. And plaque is just defined as 1.5 millimeters or greater. And so we're going to be able to risk stratify patients based on the thickness of the carotid arteries. We have a 3D musculoskeletal movement analysis. It's looking at 1 million data points as it does a 360-degree view of you. It's looking for any imbalances like your head tilt, head weight. We're looking at upper body pushing. We're looking at core strength and stability. We're looking at balance. As we age, balance is a very vital aspect of daily living. All of this, it's all a comprehensive view and painting a picture. What is the weakest point in the chain? And how do we address those weak points and optimize the individual?
Traditional healthcare, unfortunately, is broken. And we live in a system where our healthcare in the US is very reactive, and you're well until you're sick. And that's not really actually how our physiology operates. Cenegenics takes a much more proactive approach where we partner with our patients and really be by their side throughout their entire journey on a more proactive level. So we're thinking about disease prevention, how to optimize quality of life, and how to extend those good years in your life. Once you've spent the day going through all these diagnostics, we'll pair that information with your stated goals, what you feel, what you want to achieve, your blood work that you've done prior to the visit, your intake form, all the information that you've provided, any outside medical records, and then we'll distill that and take the next couple hours to work out a plan for you. And so this plan is something that we engage with you as we do it because we want something to be something that's attainable and actually sustainable, right? So your goals are going to be set, and we're going to be your partners in achieving those goals. And it's something that we do as a team approach, and we'll check in at that point, weeks after, a month after, always be in touch, always making minor tweaks and making sure that we achieve those goals.
The performance health coaching aspect of Cenegenics is probably a cornerstone of our program. The performance health coach develops an extended relationship from the physician, and a lot of our coaches and a lot of our patients become our friends. The performance health coach, along with the physician, is how we have this comprehensive approach to your lifestyle. The accountability aspect for the patient is huge, and that's where the performance health coaches come in, because they are constantly making contact. If a patient wants to talk to a performance health coach on a daily basis, we will do that. If they want to talk on a weekly basis, it's all predicated on what you want as the patient. We try to meet our patients where they are and help them change.